My name is Michael Lago. I'm a Pediatric Orthopedic Specialist. So a little bit about myself. I was born and raised in Miami. I'm first generation American. Parents are Cuban. My education, I've trained at multiple places, a very diverse education. I did my undergrad at Florida State. I did medical school here in Texas at the University of Texas in Houston. I did residency. My basic orthopedic training was done at University of South Florida in Tampa. And then my specialized training in pediatric spine and orthopedics was done at University of Utah in Shriners. So having done my training at Shriners and Primary Children's Hospital in Utah, I'm trying to replicate the model that they had, not only for scoliosis, but pediatric orthopedic care in general, trying to bring that here to the Valley. Within the field of pediatric orthopedics, my passion is scoliosis. A close second is hip problems, lower extremity deformity, but my true passion is scoliosis. Scoliosis is a three-dimensional deformity of the spine that occurs at any age of childhood and sometimes in some adults, but for kids it happens mostly when they're growing. Most of the times the most common form is that of the adolescent kind, which is discovered between ages 10 and 14. Sometimes they can complain of pain, sometimes there's no pain. Traditionally, scoliosis itself isn't associated with pain unless the curves are very extreme. Most of the pain that kids get while having scoliosis are the same aches and pains that other children get. The way scoliosis is diagnosed is first there's a screening test. It's an Adams forward bend test. But basically the patient bends over and you measure. You examine their back, you examine for symmetry, you examine the spine itself to make sure that it's in a straight line or not, and you look at the ribs and the torso. The way it's confirmed is with x-rays. Here in the Valley, it's easy to catch early because children are usually wearing light clothing. In the north, lots of kids go into winter normal and come out with scoliosis, and the parents won't know because they've been wearing sweaters all winter. But here in the Valley, things that you can notice are when the child bends over, they can notice that one side of their ribs are higher than the other, or one shoulder is asymmetric, or maybe even their torso is shifted a little bit to the side. So scoliosis has several treatments. Most common treatment is bracing if the patient is a candidate for that. And then if bracing fails and the patient has a curve over a certain magnitude, then they are eligible for surgery. The surgery is a major surgery. We're operating on a child's spine. The recovery depends on the actual child. Some children recover faster than others, but traditionally I've gotten kids back to school within a month. After the first month, they're going to school part-time for a couple weeks, and then they gradually build up. At 2 months, they're completely back to their full school hours. If they play sports, usually at 6 months. So scoliosis itself can be life-limiting and altering. It can change the quality of life depending on the curve magnitude. If the curve gets big enough, it can impair pulmonary function, cardiac function. It can also cause pain and limit quality of life in that manner. When I found out my son had special needs and the way he was treated by the specialist, that left a huge impression, and I wanted to be there for families whenever a hard diagnosis had to be delivered, and I wanted to be available, and I wanted to comfort them in their times of need.